Good afternoon and welcome, everyone. I am pleased to continue our discussion with Plenary 3, and I thank all of you for coming. This is wonderful. I'm also pleased to see that my campaign for diseducation has apparently worked a little bit. And I'm going to repeat my promise that you won't learn anything from me, but this time, you will learn from these three fine ladies on stage. So you will have an opportunity to learn something, but it will not be from me. And I promise you, from the bottom of my heart, that we will not teach you, or I will not teach you anything new, okay? But again, I'm going to show you things that you already know. So I will just draw your attention to things that you already know, and maybe we'll put them in a new light. All right, can we have our slides, please? Okay, see this? Decolonization is a newly prominent topic in mainstream discourse, but of course it's an old process, and decolonization is a long-held objective for many people. In this slide, there's nothing to get in your way, right? No distractions. You can say this word. It's okay. It doesn't matter what your position is. You can say this word, and we can all make progress. So, nothing to get in your way. Oh, except me, sorry. Now, some of you will know that Thailand's experience with universal health coverage, that's a term that was invented here in Thailand. That experience is one of the things that led our Thai seniors to start PMAC, the conference, so they could share the learnings from Thailand with the rest of the world. And they had a phrase that they talked about. And I'm showing you this because it means you can do big things. Okay, so you probably already know this, but I want to walk you through three things that you already know. The first of them is the triangle that moves the something. And if Viroj is here, he has to stay quiet, okay? Triangle that moves, and I'll give you three choices. Triangle that moves the mangosteen, my favorite fruit. Triangle that moves the monkey. Or triangle that moves the mountain. What do you think? Haha, yes, good. You're not learning anything. That's right. The triangle that moves the mountain. Just remember that. You can do big things. Don't let big things scare you. Take on big things. They matter. Number two, working on decolonial or anti-colonial topics can make you famous. You can advance the world. So who helped India gain independence from its colonizer? Barbie? Or B, Bruce Lee? Or C, Mahatma Gandhi?
Science?
Oh, C, I see it, yes, exactly. Does everyone know this? I mean, Bruce Lee's pretty awesome, but he did not free India from its colonizer. Okay, lesson number 3, global health ethics. You see something that does not belong to you. What do? Bury it for later. Yeah? I see Bruce from the Rockefeller Foundation. I think that's their main strategy, right? Okay, Or B, pretend it's yours and eat it. Or C, restore it to its rightful owner. I see more C's. Okay, good. I'm glad. So nobody learned anything. Right? You can do big things. Big things matter. 2, doing big things is possible for individuals. You should be the change. And number 3, you should do the right thing. Okay? It's not so hard. Decolonization can mean these 3 things. Move the mountain, be the change, do the right thing. So thank you for joining our panel. I'm delighted to introduce our 3 panelists coming toward me on the end there, that's Emma Rawson Tepatu, President-elect of the World Federation of Public Health Associations. Then we have Rhoda Wanyenze from Makerere University in Uganda, and Renu Khanna, a women's health activist. So I'm delighted to introduce you to these three women, and we will begin with Renu. Thank you.
So thank you, Jesse. Thank you to the organizers. I feel honored to be on this panel. I want to begin my story of decolonizing global health on a very personal note. I am very much a product of colonial influences. My paternal grandfather was conferred a title of honor by the British for his service to the empire. I was born in independent India shortly after independence, and all of my education, starting from schooling, was in post-colonial educational institutions, modern institutions. And armed with my degrees, I, in the early 80s, chose to go and work in remote rural areas in India. And I was, full of energy and full of all sorts of aspirations, and I arrived there only to fall flat on my face. It took me a lot of time to recognize that my education had not prepared me to see the realities that the women were experiencing in their resource-poor surroundings. This was a tribal area, an indigenous population-dominated district. And women had their own language, they had their own metaphors. I didn't understand their silence. And I just felt completely helpless about the task that I'd undertaken. And it took me a few years, actually, to unlearn what I'd learned in the university and to relearn from the women. I learned to listen to them, I learned to observe them, I learned to make sense of their lived experiences and their lived realities. And over a period of about 4 or 5 years, we succeeded in creating a very robust women's health program, community-based, indigenously, collaboratively designed women's health program, which actually began to be recognized as a model. So much so that we were approached by donors to undertake a prevalence study on sexually transmitted diseases. And heady with the success and the recognition, we agreed, I agreed. I was very young, and I think I was very, very naive. And I agreed to undertake that very ambitious prevalence study, once again to fall flat on my face. I had not realized that the paradigm of biomedical clinical prevalence study in a situation like this was a total mismatch. This was not suited to the way we had evolved the program. And I think this began my second lesson in decoloniality. It was the introduction, it was the beginning of my understanding of feminist participatory action research. Research which is collaborative, which is led by local women and local communities, which is owned by them. They have the control over the methodologies, the methods, the findings, the interpretation, making sense of them, and also designing the action plans based on, and then the story goes on. But I mean, I'm stopping here now so that my other colleagues can also have an opportunity to, but I'll come back to some of these learnings where the personal is actually interlinked with the global in many, many ways. Yeah. Thank you.
Thank you. Thank you. It's really important. Two major points you've made. One is to unlearn empire. That's the road in front of you. You have to unlearn some of it. And number two, when you do research with and research for, not research on other people. Thank you. Rhoda, please.
Thank you, Jesse, and I do appreciate the opportunity to share my experience in this discussion. Like Renu, I also went through clinical training. I'm a medical doctor, and there's a lot that I learned in terms of patient care. And I had perhaps the least opportunity to engage with communities and appreciate the comprehensive environment within which these patients were coming from. And when I look back, I imagine if I had an opportunity to fully change the experience that I had, that's probably one of the areas that I would need to deal with, because as we have had through this conference, one of the key things is really to think about health in a more comprehensive way, instead of just looking at this patient that's in front of you and then dealing with them without the context within which they live, without appreciating their support system, what they can afford or not afford, their cultural beliefs, and what they might eat or not be able to eat. That's probably one of the experiences that I had when I first interfaced with the communities and beginning to think about health in a more holistic way. And then also going beyond that, getting out to work with people within the community, dealing with political leadership and dealing with people that were not necessarily clinical, but they had a big bearing in determining the resources that I needed to be able to function optimally. That, for me, was another new area, and beginning to appreciate that I needed to communicate in a different way when I was dealing with other key stakeholders that needed to understand and provide a support system for me to manage. And at the time, we had some exposure to a health system, but perhaps not comprehensively enough to prepare a clinician to get out and function normally. So again, for me, those were areas where I thought we could have done differently if we were to reorient my education. And then come the partnerships. I need to work with so many people, and being able to negotiate how we work and what we do together and who does what, then is a new experience again. And I'll probably talk more about this, but I think one of my greatest learnings in encountering issues of power relations and privileges was when I got into my first partnership, a global partnership, and working on a grant with a team, and naively assumed that understanding my setting and communicating what we needed to do and what my country needed to do was enough for me to get the key questions that we needed to answer that were more relevant towards my country into the project. That was not the case. And again, I needed to learn how to negotiate, engage, and navigate very complex terrain to be able to manage to get questions that were relevant to my country into this research project, something I assumed was almost obvious. And again, when I tried to consult around with my seniors, I didn't necessarily get straight answers, except that this is what always happens in these partnerships, and welcome to the world of partnerships. So there is a lot, perhaps, that we were not fully prepared for, but that tends to happen, and you learn on the job when you're out there. And perhaps these are some of the things we need to rethink in terms of how do we actually prepare young professionals to manage within this space so that they are part of the solution. Thank you.
Thank you, Rhoda. I think these are wonderful points, and just to underscore two of them. One is that we work in a context. People are our business. So we need to respect that context by reaching out to communities, by reaching out to the patients, the political officials, and the rest of the people who comprise a society. If you hope to provoke health in that context, you need to engage all of it. And the second is that partnerships, they begin on a distorted basis in most cases because of the unequal access to resources. It takes some intentional approaches for us to overcome that. And we should all do that out of respect for each other. So thank you. Thank you, Rhoda. Emma, please.
Tēnā koutou, tēnā tātou katoa. Tēnei te mihi atu kia koutou ko tai mai I tēnei rā. Te mihi tuatahi ki ngā tangata whenua o tēnei rohe, tēnei te mihi, tēnei te mihi, tēnei te mihi kia koutou. He mihi anō nei ki ngā kai whakawā, ki a koe Jessie, tēnā koe, tēnā koutou. Kia koutou katoa ko tai mai ki te whakarongo ki tēnei kōrero, tēnā koutou, tēnā tātou katoa. Ko Waio, ko Ngāti Rangi Nui, Ngāi Te Rangi, Raukawa me Ngāti Haua, ko Emma Waimari e Rawson tōku ingoa. Ko Mawau te maunga, ko Wairoa te awa, ko Taki Temu te waka, ko Tūtiranga te marae, tēnā koutou. Hello everybody, it's really lovely to be here with you today. What I've just done is I've spoken to you in my native tongue, which we call Te Reo Rangatira, Te Reo Māori, the Māori language. I come to you today from Aotearoa, New Zealand, a proud Indigenous Māori woman. I've spoken in my language because I wasn't born with it. I am a picture of colonisation. My mother is white New Zealander, my father is Indigenous. 2 generations before me grew up with no language. I went to university to learn my language. This is a really true example of what colonisation has done in Aotearoa, New Zealand, and it's only one very small part of that picture. And I wanted to start with that because it's a really true and raw example that I can share with you about myself. It also is the beginning of my journey into how I came to work in global health and decolonising global health. It's a very interesting conversation to be part of, and I'm again very grateful to be invited. The work is deeply personal. It's an interesting space to be in as an Indigenous person from a first world country, a country like New Zealand that's seen as very much world leading in terms of race relations, in terms of how we operate as a nation of 2 peoples. We're very fortunate in New Zealand that we have a treaty, and that treaty has enabled us to be able to work together as best as possible in our colonial nature. What we're seeing currently in New Zealand is that nothing is sacred, and we have a new political regime in New Zealand that is threatening to undo the gains that we have made in the last 50 years. What's good about that picture is my people have understood from 1840, the day when the treaty was signed in New Zealand, that we have sovereignty and never ceded our sovereignty. And so all of our work that we do, that we have done, continues to be on a platform of unceded sovereignty. I'll talk more about that perhaps in the conversation later on, but I just really wanted to show you a little bit about myself and how I look in this picture in terms of where it drives me to work on this global scale. So thanks, Jessie, back to you.
Thank you, Emma. Emma is making a particularly important point about our discourse. Can I like polls, as you know. Can I ask for a show of hands of people who speak more than one language? No? Oh, okay, good. All right, good. Okay, look, it will not escape your attention that the things you can say in one language cannot fully be expressed in any other language. And yet the language of global health is almost exclusively English. This matters, okay? It's an obvious point. I love to say the obvious. I get awards from my teaching, and it happens only because I tell stuff people already know. So what we've been doing up here in our first round of questions is to talk about how colonialism has touched each of us and how it has affected the development of our communities. The afternoon's parallel sessions follow an organization that we borrowed from the Peruvian scholar Quijano, and he had a theory about the pillars of power that support colonialism. One is economy, one is control of gender, and one is control of knowledge. So I'd like to, we have these mics on either side. We're happy to take questions from the audience. And I'd like to invite our panelists again to reflect on how those categories have shaped their experiences, maybe by choosing one example from economy or control of gender or control of knowledge. Renu began by talking about education and empire. And it's true that all of us present here have earned a place by complying with empire. You're young, you learn stuff, you do well in school, and you get more opportunities. But decoloniality requires you to start unthinking and unlearning some of that as a conscious process. So we're continuing that here. Renu, why don't you begin, and anyone with questions just line up and we'll take them. Thank you.
So, thank you. So the one example that I want to speak to is in the domain of knowledge. And the example that I want to present here is the work that we're doing in sustainable development goals, localizing sustainable development goals from a gender perspective and the leave no one behind in India, in several states of India. And we've come to the realization that leave no one behind, the way it is understood and the way localizing SDGs is understood, for example, by the national government, by the subnational governments, by UNDP, is that the national indicator framework will be transmitted down to the subnational levels, and they will decide on their indicator framework. And what we are submitting is, especially if you keep the leave no one behind as a central focus, is that many of our data systems do not capture the left behind in particular contexts. Many of these communities, these groups, are invisible because of maybe stigma, invisible because of the historical disadvantages, the political disadvantages that they have, the social exclusion that they've been faced with, the layers and layers of intersectionality that they are sort of living with. And so localizing SDGs for us actually means visibilizing the left no one behind in particular contexts, which means evidence generation at the primary level, which means nurturing the left behind groups, facilitating their voice, facilitating their participation in local planning, and also in transmitting their voice and their issues at the global level. So the global to the local and the local to the global is how we understand localizing SDGs to be. And to give that meaning, I think we also need to examine indicators. The indicators which the governments celebrate, the aggregates, the coming down of the maternal mortality ratio in India, for instance. When we speak with our communities in Assam, working in tea gardens, women who are labor in tea gardens, they say, well, the aggregate, but I see so many maternal deaths around me. So that aggregate doesn't really have any meaning for me. So my point is that the aggregates do not capture inequities, and we do need other sorts of indicators, process indicators, to be able to measure the inequities and to be able to measure the progress towards SDGs, and indicators which make sense to the communities so that they can monitor the progress for themselves. That to me is localizing SDGs, and that to me is a central focus of decolonializing knowledge, the way we should understand it. Thank you.
Okay, so I will build on the example that I ended with on the issues of partnerships. And it's been an area of great interest to me, and I think it's really relevant to the theme here as well, dealing with issues of equity within the kind of crisis that we have, and complex challenges requires that we work together, and working together across disciplines, working together across experiences and bringing different voices together, but it also requires that we pull together the available resources and expertise across the North and South, but also especially bringing in our communities. And my experience that I noted earlier, trying to engage in my first partnerships, if I could build on that, about 20 years ago, precisely when I started my first partnership, where I felt these questions that we built together and where we were able to integrate some of the local questions were so critical to what we were going to do in terms of the knowledge that we would generate and the potential utility of that knowledge for us as a country. And so we moved along, got some in, and others didn't make it in, and we agreed, okay, at a later stage, we'll probably, if we are funded, have an opportunity to embed more questions into this research that will really speak to our needs at a local level. Unfortunately, that was really complex much later on, and we had to go through a lot of negotiations where by the time we had the space to introduce new questions, it was almost a year down the road. And we had to do this again after we were, the co-lead of this project comes in and says, it was a multi-country project, and says, okay, so it's fine for you to introduce these questions, but I think you'll do them at no additional resources. And we thought this was really important for us. We needed to do it, and we said, yes, we will go ahead and do it, even without additional resources. And all we needed to do was cover the costs of the people that were collecting our data, but we went ahead and, with no additional effort for any of the investigators locally, we were able to do our research and completed it. But a few months down the road, it turned out that that's what the other countries in Africa also wanted. And another country comes up and says, we need to do what the people in Uganda were doing. These questions are also important to our team. But long story short, it turns out that a year down the road, these were the most critical issues that we needed to respond to. And now, that data and everything else was also controlled fully by the same people that said, you can't answer these questions. And then we get back to these documents, and I realized somebody had signed off for us a contract where we had no ownership to the data that we were collecting. And although our questions were now critically important, we could not actually easily disseminate this information. And our stakeholders locally are saying, we want to know what you found. These questions were so important to us. And the PI is saying, not as yet. And we are negotiating and saying, look, this is not a publication out there in the public domain. We just want to disseminate this to our local stakeholders. And they're saying, wait a minute, it's not yet time. But they are saying, it's time for us locally because we need to make decisions. So for me, that was one of my complex issues, and started off my journey of getting interested in how do we actually negotiate these contracts? How do we begin to look deeper and negotiate better? And even then, I was trying to get back to some of my senior colleagues and say, wait a minute, what are these issues? And I remember one of them saying, who owns the data? Who is it that determines the resource distribution, and who is it that will actually decide when you disseminate and how, are very complex issues, and they continue to happen, but we don't talk about them. 20 years ago, this was a topic that we didn't talk about, and up to now, there are many of our young colleagues that go out there without necessarily being supported and being given an opportunity to be able to get into this. But building on that, over time, we've tried to dig deeper into these issues, and we've been working as a team from Makerere University and colleagues from FHI 360 to try and dig deeper, and we've actually done some interviews with several other people across the African continent to get their perspectives on the experiences they've had while engaging in partnerships, and the same issues keep recurring even up to today. So I think we need to actually speak to these issues if we are going to speak to the decolonization agenda for global health, because in my experience, if you don't ask the right questions, and as we all know in this room, you're not going to get the right answers. If they are not relevant to the local communities and the questions they have, it's not going to be useful. So even when down the road we are getting into the knowledge translation, it becomes really complex. But at the same time, it's not just the local researchers, it's not just the ministries of health and other sectors, it also extends to the communities. What is it that we are building on the communities? Going beyond research to interventions in health, some of which actually turn out to be really disruptive rather than creating solutions. But I also need to highlight that I've had really nice experiences on a positive note, and I think there's a lot of progress that's happening in this space, especially when there is an institutional framework that is supportive, and you have, senior people to provide guidance and support, especially for young people, enhancing our skills to be able to negotiate and navigate the power relations in terms of the ownership and participation of local communities. So I see progress in many ways around us. We've had really some good partnerships where speaking about how we are going to work is part of the initial discussions. Speaking about how we are going to make sure that the voices of all the key stakeholders come through is something we do. But also protecting the most vulnerable. How do we hear from our younger colleagues? Because that's another issue. Sometimes the senior people, even within the same setting, don't give as much voice to the young ones. How are we going to hear them? How do they take credit for the work that they do, so that they are not just doing the work for the senior professors that are then the lead authors and the first authors when the actual work is being done by them. So we've had some conversations around that and moved towards truly respectable partnerships, building on experiences and the work that we've done. But we also begin to see changes at the global level with the several institutions that are beginning to adjust their policies, funders that are beginning to call out for more equitable partnerships. So on a positive note, 20 years down the road, there is so much more that has changed. And perhaps even this discussion in itself is something that would have been unheard of the time when I started my partnerships. Thank you.
Thank you. Do you mind if I ask her? Oh, Emma has kindly given us permission to go to the audience, and I'd love to do that so I don't have to think of another question. It makes my head hurt. So thank you very much for stepping up. Please, tell us the question.
Good afternoon. I am Tris Esteban from the Planetary and Global Health Program of the St. Luke's Medical Center in the Philippines. First of all, I would like to thank the panelists for the discussion and for sharing their knowledge and expertise in this very timely topic. We talk about decolonizing global health and pushing for inclusivity, and it almost automatically refers to breaking the boundaries of race and ethnicity. However, gender and sexual identity is not considered as much in global health conversations. We have seen in recent years an increased inclusion and representation of women which is, of course, laudable. But when we talk about women, do we also consider trans women? And to go even further, what of the non-binary identities? As a proud member of the LGBT plus community, as someone who herself identifies as a trans feminine and a gender equality advocate, where are we in this decolonizing global health narrative?
Thank you. And I'd like to thank PMAC's organizers as well, because part of the answer to your question is you're right here, and you're talking to us, and we appreciate that. Thank you. Thank you very much. So let's go to the center, and then we'll come back. Thank you.
Hello. My name is Eliani, a doctoral student at Harvard. Kia ora, Emma. In your position as president-elect of the World Federation of Public Health Associations and the first indigenous woman to hold this position, what do you envision for your future work in terms of decolonizing global health? I ask myself as an indigenous woman from the Malay archipelago, present-day Brunei, Indonesia, Malaysia, and Singapore. Thank you.
Kia ora, Lynn. And thank you for your question. Look, it's really important to me to answer this question and be really clear about where I come from. And I alluded to it when I spoke before. I am an Indigenous person from a first world country, and I come into this role in a very humble way because I understand the privilege or the relative privilege of coming from where I come from as an Indigenous person and the opportunity to be able to drive forward the decolonising agenda for the World Federation from a place that is much more safe than many other Indigenous populations across the world. And so I've been driven to come here because of my journey as an Indigenous woman that I alluded to before, growing up without language, growing up without elders, not growing up on country, and seeing and understanding the lack of value placed upon Indigenous knowledge. And so yesterday really clearly to me, and through the conversations that I hear a lot, people talk about realising, the need to work together and collaboration and a whole lot of other things, that our Indigenous populations have lived for hundreds of thousands of years. And so I want to be part of the movement that re-centres Indigenous knowledge and Indigenous voices and brings them back to the place they belong, which is really the place that we all come to when we think about the survival of our populations and the survival of our planet. Our people have been caring for and taking care of human beings and human nature forever. And I want to see that being spoken about and understood as the way in which we position ourselves and move forward into the future for our collective survival. Our people have never been about their own survival, they've been about the survival of everyone. And so I'm driven to work on that premise alongside the Federation. And so for the next 2 years, we're going to do some really important work. The first part of that work is to come up with a working definition of what decolonising public health looks like. And I say that a working definition because there are many voices that need to be included in what that definition is. The other part to that is, whatever it is that we define, we need to be sure that we have doable and sustainable actions that can back up the definition once we say that this is the work that we're going to do. So my plan is, not my plan, but the plan of those of us that are working in this space with the Federation, and that's the Indigenous Working Group of the World Federation primarily, but we also welcome others who want to be part of this work to come alongside us and work with us on this program. So we have the definition, and then we'll have a plan of work which is really around educating people around what is decolonising public health, what does it look like, and then what are the actions that are realistic and sustainable. 2 years in my position is not a very long time, so we need to be really realistic about what we can do to, what's the word I'm looking for, embed these ideas and the beginning of these actions into the future work of the global public health community. And I'm confident that we can do that, but there's a really important piece to that, and that is, in doing this work, we need to think about time differently. It isn't time that's urgent in order to get an outcome. It's time that's flexible. That means that the work that we put in place has the time that it needs to live into what it needs to be. I think that's some of an answer. Thanks, Lynn.
Thank you, Emma. I'll come over to Renzo in just a second, but I'd like to pick up one of Emma's points, which is that Indigenous people have successfully shepherded the planet and humanity for maybe 100,000 years or more. The process of releasing hydrocarbons that brings us to climate change is very closely connected to colonialism. So the seizure of lands, for example, in the United States, if any of you have a chance to watch Killers of the Flower Moon, in part that's about the theft of indigenous lands to get access to oil. The colonial processes have often been connected with the search for energies, and then the utilization of those has been in the support of unsustainable lifestyles. So it's worth connecting many of these agendas. Let's take, Renzo, let's take you, and then we'll come over there.
Sure. Renzo Ginto from the Philippines. Thanks, Jesse, for actually connecting colonialism with the climate crisis. In fact, we have a term for that, atmospheric colonization. And we are even colonizing the ability of future generations to live and thrive. And that is not yet part of our decolonizing global health discourse. But my main question is, for the past 3 years, while we're fighting a pandemic, we've also seen this decolonizing global health virus circulating everywhere around. Every school of public health in the West, in the global North, has organized a decolonizing global health webinar, symposium. There are a few schools that created task forces. Every important global health organization in Geneva has also organized their own, workshops, etc. And it seems that apart from greenwashing and health washing that we were talking about in the previous session, what's now happening is the colonized washing among different organizations in our global health ecosystem. So my question now is, how can we go beyond the cosmetic and really, truly, usher the transformations that are required to decolonize global health? And maybe that's a question for the entire room as well. Thanks.
Thank you, Renzo. Yeah, so we have 7 or 8 minutes left. I'll come right to you in a second, Mel. Our last trip down the panel will be to ask for some pragmatic solutions for what we can do right now. So yes, we hear you and we're going to do that. Please, go ahead.
Hello. Hi, my name is Mel Etty. I'm a medical doctor from the UK. My question is actually specifically for Professor Roeder. I was really interested to hear about your experiences of negotiating ownership over the knowledge that you had produced throughout your career. I was just interested in your experience, to what degree did global health institutions help or hinder those negotiations and the accompanying bureaucracy that comes with working with those institutions?
Excellent, thank you. I think, why don't we take it looks like we have a last question up there. Shall we take that and then we'll get back to the answers? Is that okay? All right, please, yes, question.
Great, thank you. I'd just like to say that everything that's been said so far is a really important part of this decolonizing conversation. But what I'd like to do is just add another element to colonialism, which is very much a contemporary phenomenon as it is a historical phenomenon. And a part of the contemporary colonialism we have now is very much linked to the process of globalization that's occurred over the last 3 or 4 decades, that has seen patterns of wealth extraction and resource extraction that are themselves globalized. We have a form of transnational, financial and corporate colonialism that is sucking up wealth and resources across the world, across geographic boundaries, across racial boundaries, across regional boundaries. Since 2008, we've seen a disproportionate amount of global economic growth be captured by the 0.01% of the world. Anyone who's been tracking Oxfam's inequality report will no doubt be aghast at the fact that 10 people own as much wealth as the bottom 3.5 billion. So I'd like to ask the panel what your thoughts are about this form of corporate financial colonialism that's organized at kind of global, transnational level. Thank you.
Excellent, an excellent question. I think the panel's answer is probably tax reform and trade reform. Okay, panel says tax reform. Good, all right, we have 6 minutes left. I mean, that's a flip answer, but it's actually the truth. We need tax reform. Yes, so let's start with Emma and we'll come down. We've got another 5 minutes, so a couple minutes apiece.
Yep.
Thanks.
Thanks, Jesse. I'd actually like to bring some of the answers of a couple of those questions together. And the first one is the young person that spoke over here around transgender, and then also Renzo's question, or was it a challenge, not sure quite what it was, around the hijacking of decolonisation, and then also this gentleman's question. And it does come back to the idea of the word decolonising being hijacked. First of all, I'd like to say I don't like the term anyway. I prefer the term reordering, and I think that thinking about reordering enables us to think about how we reorder our society and all of the aspects to it to be more inclusive and to share power more equally in order to have the outcomes that we need to have. Decolonisation has been hijacked, and many social justice movements have hooked onto it as a sexy word in the day. And we need to be really clear that the whole idea around decolonising is to acknowledge what happened originally to Indigenous populations, and then the other effects on top of that that followed on along with the process that then became the broader part of colonisation. So I'm just wanting to address those three things and be clear that I don't like the term generally. It's useful, and that's why the whole idea of the fact that we really need to be really clear around educating people around what it actually is so, so important. And that's the thing that gets missed all the time. We come up with ideas and we talk about them, but the general population has no idea what we're talking about. So we need to get better at sharing the message and helping people understand it so they can come along for the journey. Kia ora.
Thank you, Emma. Excellent. Rhoda.
Thanks for the question, Em. So at the time when I went through this journey, I just realized that part of the biggest issues we have is the institutions that we partner with. There are many structural issues, and that sometimes the institutions and the leadership in the institutions has been so comfortable with certain things that they don't actually take time to think. That you have an institutional policy, for example, where you're partnering with another organization and you require them to sign off their contribution and participation and ownership of all the products, and you're comfortable with it. And when you ask questions, you're told, this is our institutional policy. So if you got to sign it, if you're going to work with us. So we still have many institutions that actually do that. You have institutions where you might even sign off being an author on certain things. And I found myself challenging this in supporting some of my younger colleagues so that they are not exposed to this. And quite often you're told, this is our institutional policy, but these policies are developed by us and we can change them if we have the commitment to. So I would say it didn't help too much because at the time many of the institutions were not structured that way and their policies were not helpful. But I need to note that several institutions have started revisiting these policies, and hopefully we can all begin to shift to that and re-examine the contracts we ask other institutions to sign off. But also as individuals and teams, as leaders, whether it's in science or programs, we can begin to question some of these things so that we can shift them, even when the institutional policies might think otherwise, at least where it allows us room to do things right. So it wasn't too helpful, but I think with time we are beginning to see a shift. Thanks.
Wonderful, thank you. And please, our almost last word.
Okay. So these are very difficult questions to answer. And I begin from the personal. I mean, again, I think that what we're talking about, decoloniality, the core of it is power. And each one of us wields power wherever we are. And I think reflexivity is something which is extremely important, becoming aware of how we ourselves are wielding power or how are we sharing power. That's point number one. I think the discourse is going on so many levels. The other point that I want to make is accountability. How do we ensure and enforce accountability? I mean, we have all of these structures, and how do these structures are given the teeth so that they are able to deliver with a set of shared values. We talk about shared values, solidarity, and I think it's up to each one of us and the institutions where we are to make sure that some of this actually becomes a reality. And I think the road is long and arduous, but I think the horizon is there. Thank you.
Yes, thank you very much. Thank you. Thank you. I think we can't leave the question standing, so let's have a quick one, please.
Hello, my name is Manshuri Sangmung. I'm originally from Thailand, and I'm the chairperson of the Asia Pacific Pharmaceutical Student Association. We represent 100,000 pharmacy students spanning from Pakistan to New Zealand. But I'm not here to ask you a question. I'm actually here to offer you a solution. Besides decolonizing, I would like all of us to start localizing. Students are from everywhere. All of us represent one community. We grow up from somewhere. I'm from Thailand. Everybody told me, oh, you deserve better. You should move to Global North because you are more than enough for here. I said, why? Thailand also deserves better too. Why can't everyone deserve the same better? So what I'm saying right now is that all of you, all of us coming from somewhere should have the time to go back and represent our community and start localizing, start from the ground, the villagers, the people, our family. It's not a time we be the change we want to see. It's the time for us to be the change that everybody has to see. Thank you so much.
Good, that's a spectacular note. Thank you. We will end on that one. And as we close, I'd like to remind everyone that decoloniality or recentering or reordering, it begins with yourself. A good first practical step is to ask how you connect with colonialism, how it has changed you, and how it has affected the development of your communities. You can start with that question. It will lead you to a respect for others, and it will lead you to a more diverse epistemology that will guide you to better solutions. So if you have a mind, use it. If you have an opportunity, share it. So thank you. Thanks for attending. Thank you.